Danger of perpetual backlog unless something to be done. And joining me now is Debbie Fleming, Chief Executive of the University Hospitals Dorset NHS Foundation. Hi, Debbie. The staff must be tired, you know, having dealt with all these things. You can't just do this on overtime, but maybe you've learned some good ideas about doing things differently.
Absolutely. I mean, we're very, very clear that the recovery of services has to be paced with staff at front and centre. So our staff are very tired and hospitals are very, very busy. But clearly people are excited about trying to get on top of these growing waiting lists and are really willing to try different and innovative things in order to do just that.
To break the backlog, what's your plan in Bournemouth? Because it's quite an interesting one, isn't it?
It is. So we've got a package of measures. And I mean, today we want to particularly talk about the health village, which is great news.
The health village?
Patients, staff, and also for the town centre.
Yeah.
But we have to remember that's part of a wider package of initiatives. We've got a really important clinical validation programme going on to make sure that everybody on our lists really does still want and need treatment. We're then doing a lot of work to connect with patients and help people to remotely have digital appointments, virtual appointments, information and advice for those who do need to be seen, for the ones that are the high volume, the low complexity types of treatments or assessments. We can do some more of this in the health village. And then, of course, the most important thing is that people have got the advice, that they've got the treatment programme or the signposting onto something else at the end. So there's a lot going on. This is just one of the features, really.
Right, and so the health village is using town centre walk-in to see a consultant and a lot of triaging. And you're planning to literally do this in shopping areas?
We are indeed, but I need to be clear, it's not a walk-in facility, it is absolutely a booked facility. And clearly it's not going to be right for every single patient or every single specialty. But it is hugely innovative. Effectively, we've got the space in a local shopping centre.
This is the Dolphin Centre and Pool, yes?
We're setting that up with all the learning from the vaccine work and how do you organise things really efficiently, use space differently so we can see the greatest number of patients in a really good way, but also using staff to very best effect as well.
But a consultant won't have so long as he would doing the traditional way of having a referral in and an appointment and all the rest of it.
Well, it's fascinating because our consultants are really interested in this and very keen to try these different ways of working, because we want people to be what we call operating at the top of their licence. We want people to be doing the things that only they can do and not always having to do things that actually perhaps others can do and support them. So there'll be a range of staff available within the health village and volunteers. And I would say we're looking to recruit a lot of volunteers in the same way we did with the mass vaccine programme.
Right.
But what we'd expect to do is to design the service so that people are able to come in, they go through the pathway, the rooms are designed around the pathway, and they see the consultant at the end once they've got all the information that they need, the diagnostics that they need, that all the other bits of the pathway have been completed. So it uses everybody's time to best effect, and people feel really good about that, and we see much larger numbers of patients.
OK, that's one way of seeing larger numbers of patients. Let's bring our two political guests in. Tom Hayes, does it feel a bit like cutting corners to you?
I think it's an example of where if you give healthcare professionals the opportunity to use their clinical judgment, you can sometimes produce amazing results. And I'm really looking forward to seeing what the outcome will be of this particular innovation. But I think it's not going to be enough, is it? We know we've got a huge backlog. We've got people left in limbo waiting for treatment. And so we need to have the government coming forward with a rescue plan for the NHS. We need a fair pay deal for our NHS staff who have done absolute wonders over the last year and need to be given that boost to their well-being and to their morale. We also need to be having the government pause its planned reorganisation of the NHS. Why would you go through such a complicated reorganisation when the NHS is going through the greatest public health crisis that we've ever known? And I think we also need the Prime Minister to get a grip on this. When we last saw large waiting lists under the Conservatives, which Labour, then in government, Blair and Brown, had to fix, you saw the Prime Minister create a delivery unit in his own office, where the Prime Minister held accountable the Secretary of State for Health, who then worked with the NHS. Could you imagine this Prime Minister getting a grip on this situation? Could you imagine this Secretary of State for Health getting a grip on this situation? And I just wonder if Flick agrees with Dominic Cummings.
I can see that one coming a little way away. But Flick Drummond, answer some of those points, because there's been a lot about Matt Hancock in the news this week.
Well, firstly, I just want to pay tribute to all the NHS staff as well. My daughter's a doctor in a busy London hospital, so I know exactly how hard they've been working, and they are tired. But the initiatives that we've just heard about are just the right way forward. And I just want
and a little bit of extra money for their pay. You'd vote for that, wouldn't you?
The junior doctors have done well. The nurses have also had a pay rise. So, and consultants are well paid. So, and the whole economy has to be looked at the same time.
Okay.
But of course, everybody wants to get more pay.
What about setting up this war room in the Cabinet Office and getting more of a grip on it all? Do you feel the Prime Minister and the Health Secretary are working well together?
They absolutely work extremely well together, and I know they back each other up. And it's very interesting just looking at the NHS long-term plan that's coming forward and the use of development of AI, for instance, to help medical treatment. I'm sure Debbie is probably using quite a lot of that in the way that they work down in Dorset. That is the way forward. And I just want to point out that in Hampshire, cancer treatment has been between 6 and 8% above the normal average over the last year. So there are examples where people have been treated and it's been working extremely well.
Debbie, have you got morale up? Can you keep it up?
So I think we have to remember our staff have been through a really, really difficult time. Everyone's been through a difficult time, and we all pay tribute to them. I think the honest truth is that people feel differently perhaps in different teams, and some teams are still under huge amounts of pressure. But staff are feeling encouraged about getting on top of the waiting list, seeing things begin to get back to normal. We focus on what we can do rather than what we can't do, to be honest. There's lots of challenges for the whole of society coming out of the pandemic. Our people are innovators. Our people, they want to treat patients. They want to try new things. And this is something that's encouraging them. So I think in this particular respect, it's a bit like the vaccine programme. When everyone gets behind it and people work together, that boosts all of our morale.
Well, we wish you a lot of luck. Thanks.